Good afternoon. I'm Alan Vandriel, the CEO at Smith County Memorial Hospital. With me this afternoon is Dr. Farrell Conant. Dr. Conant's one of our staff physicians, probably well known to most of the community. He also is the county health officer now for Smith County. What we wanted to talk about today in particular was the safety measures that we are putting in place, that we have put in place here at Smith County Memorial Hospital and Smith County Family Practice. We want to talk about those a little bit because what we really want to do is emphasize that despite what is in the news recently about the rising number of cases in this area of COVID-19, we want to emphasize that it is still very safe for all of the residents here to receive their care, whether it's routine care, whether it's well care, or whether it's care that you need because you're ill. So we want to talk about some changes that we've made here to make it even safer for you to come and get that care at the hospital and at the clinic. So the first thing I think we want to talk about is a change that we made a couple of weeks ago now, actually, as far as access to the clinic and the hospital. We're going to focus first on the access to the clinic. We changed our process to make our waiting room for the clinic the parking lot. When you come to the clinic, we ask that you call the clinic from the parking lot and let the registration staff know that you're here and what you're here to be seen for, if it's a scheduled appointment or if it's for a quick care. The registration staff in the clinic then are going to ask you a series of questions about the status of your health, whether you're having symptoms of respiratory disease, whether you feel like you're running a fever, the standard questions that I think many of you are accustomed to being asked on entry into any healthcare facility. They will go through the registration process that you normally would have gone through sitting in a registration booth and ask you the questions about your address and your insurance and so forth. We continue to ask and emphasize for billing purposes that when you come to the clinic for services that you bring your insurance cards with you, because they will likely ask you to see those cards. Then when they have your encounter registered and have all of the information that they need, they'll tell you to stay in your car and wait for a call from a nurse in the clinic, who then will call you and meet you at the front door and take you directly to a exam room in the clinic, so that you won't spend any time sitting in the waiting room in the clinic being exposed to other people who may be sick, or if you're sick, you're not exposing other people. How do you think that's working?
Thank you, Alan. I think the process, certainly a new one to us, having a parking lot waiting room was certainly different. As a practitioner, the end result hasn't changed very much for me. I see the patient when they finally arrive in my exam room. So we get feedback from our patients, and I think in general it's been positive. It hasn't been an ordeal for them to register in that fashion. I think our nursing staff, they're getting accustomed to that new process also. It's new steps for them, but it's worked well, and we think the theory and the method that we're using is sound to try to limit chance of spread within our facility. So I think it's been a success, still a process that we're trying to fine-tune a bit, but I think it's worked pretty well.
Overall, the impression that we have from questioning patients that have been into the clinic is that it really is not taking any longer, and in fact it may be quicker now for them to get actually into an exam room with this new process. The important thing about that, again, we want to emphasize the safety associated with this. We're coming into flu season, and every year at flu season we worry about the cross-contamination, the exposure from one patient to another. And we always try to take steps to minimize that by having a person who has symptoms put on a mask before they come into the clinic. And that's one of the things I didn't mention when I described the process before, is that when the registration clerk in the clinic asks the questions, one of the questions they will ask is if you're having symptoms, and if so, they will ask to verify whether you have a mask with you or not. If you do, they'll ask you to put it on before you come into the clinic. If for some reason you don't have a mask with you, the nurse that meets you at the front door will give you a mask and ask you to put it on before you come into the clinic. We want to talk a little more about some other processes as well that we're doing, and that has to do with the fact that if we have a person in the clinic who has respiratory disease and they get into an exam room and the nurse and the provider examine them and review their symptoms and determine whether or not there's a need for laboratory testing for confirmation. If that laboratory testing is done and the patient is symptomatic, most all of the time the laboratory staff will come to that room where the patient already is and do the sampling, whether it's blood sampling or in the case of a respiratory disease, they may do a swab of some kind or another. They will come to the clinic exam room and do that sampling. And then you as the patient will receive instructions from the provider in the clinic as far as what you should do afterwards. If they're suspecting that it may be influenza, or if they're suspecting that it may be COVID and they've tested you for that, they likely will give you instructions about how to stay away from other people so that you don't transmit the disease to anybody else. The next thing that's going to happen is that the clinic staff are going to notify our housekeeping staff, and they're going to come and they're going to do what we call a deep cleaning of that exam room. And this goes on multiple times every day, so that anytime there's somebody that's been in a room that has a disease that's spread by droplets or by contact, that exam room is going to get disinfected before the next patient comes into the room. And that's something we've always done, but particularly now with the incidence of respiratory disease, of COVID and other respiratory diseases, we've really re-emphasized that to our clinic staff and to our housekeeping staff, that if they have a suspicion that there's something going on, we need to really be sure that we're doing a thorough disinfection of the room so it doesn't get passed on to the next person that comes into that room. In a future presentation, we're going to talk a little bit more about some new technology that we have that we've implemented in the hospital and in the clinic that just adds another layer on top of that deep cleaning that we do in those patient rooms, just again to make especially sure that we're not leaving a dirty environment where somebody could pick up a disease from being there. The bottom line to all of this is what we've heard from the providers consistently for the last 8 months that we've been dealing with this pandemic now is the thing that they worry about the most is people being afraid to come and get care when they should be getting it, either routine preventive care, follow-up care, whatever.
We believe this is evident all across the nation, and there's plenty of documentation that patients are, for the reasons that we've discussed, anxiety or fear, thinking they may be exposed to a disease. If they come to our office, they just don't come in. And we fear that we're going to later reap the bad fruit of that delay of care, maybe with even someone who may have a disease or a cancer that we might have diagnosed earlier, but we're not able to because the patient never came to our attention. Certainly, it's also true that many patients with chronic care issues, diabetes, hypertension, lung disease, kidney disease, if they delay care for those conditions, that's detrimental to their health. And so that's, in many ways, more as dangerous as COVID. It has, it's a different way of thinking about this, but we know that there will be negative repercussions from patients who delay care, So we want to be available and are available for those needs, and we want them to be still front and center and important, and regular visits, we feel they're important.
Again, we say this multiple times every day among our staff, and we say this to the public that safety, 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 safety is what we're here for. We're here to provide care for you, for your health maintenance, and we want to make sure that you're safe when you're coming here and getting that care. The hospital side is a little bit different, and I want to touch on that just a little bit as far as what you'll see at the hospital side. We have limited entry into the facility basically to 3 entrances, which as far as the public is concerned are the same 3 entrances you're used to coming in. So there's the clinic entrance, there's the main hospital entrance, and there's the emergency room entrance. The difference is we've limited the hours that the main entrance is available for people to enter, but the emergency room entrance is available 24 hours a day. At the front entrance to the hospital during the 8 a.m. to 4 p.m. hours that it's open, and 24 hours a day at the ER entrance, if you come in through either of those entrances, you will meet a staff member who's there specifically to provide a screening. And that screening is going to consist of them asking you some questions, again, about what symptoms you may be having, whether you've been asked to quarantine, whether you know that you've been exposed to someone. If you are exhibiting symptoms or think you may have been exposed to somebody, they will make sure, if you don't already have a mask on before you come, they will make sure that you have a mask on at that point, and they will take your temperature. And we're doing the same thing with every one of our staff members that comes into the building. Anybody coming into this building is getting screened with that question process, and they're having their temperature taken, and they're if necessary, they're being asked to put on a mask. Once you get into the facility, you will see that all of our staff within the facility are now wearing masks. They're wearing a cloth mask in a public area if they're non-patient care staff, or if they're patient care staff in a clinical area, you'll see them wearing a surgical procedure type mask. So we're trying to completely eliminate, wherever we can, the possibility of spreading any disease. And again, we've taken extraordinary measures to make extra sure that we're disinfecting, we're deep cleaning rooms after patients who have been ill have been in them. So whether it's in the hospital or whether it's in the clinic, if you're supposed to have care, if you're supposed to see one of the providers, if you have a new onset of an illness and you need to come to quick care and be seen, if you have follow-up care, if you have a chronic condition that needs to be seen, as Dr. Conant said, we definitely want you to keep your appointments and continue to see the providers. If you have lab work or if you have imaging studies that need to be done, mammograms, routine things like that, if you have an appointment to get those done, by all means, come and get them done. We just have put these extra safety measures in place to make sure that this hospital, this clinic, this facility is the safest place in town for you to be, and that there should be no reason why you not come here to get your care.
I agree with you, Alan. I think our team has done an excellent job of going the extra mile to provide a safe environment. We're confident that you can come here for all of the reasons that we normally would see you, including sick visits. So we encourage people to not be anxious or afraid to come see us. We feel you're safer here than probably about any other place.
So that's the message for today, is that this place is as safe as we can possibly make it, and we look forward to seeing you all here for all your healthcare needs. Thank you, and we'll see you next time when we talk about some more features of our safety plan.
Thank
Have
you.
a good weekend.